have been working through some things. All right, we coming up now. All right, everybody. Thank you for your patience tonight. Woo! We have so hopefully people are seeing us, right? We're gonna hope. And what I wanted to do today was get on today and discuss multiple sclerosis with you all. And I'm so happy that we have Dr. Jacqueline Rosenthal here to talk to us. And I'm sorry, y'all. I'm thrown. I'm just I'm having a moment, and we're so thankful that she's here. And I just want to I'm just trying to make sure that this is actually going in the space where for the people who actually need it.
Yeah.
And I think I see myself talking. Do I? It says I was live. Okay, since I am live now. Okay, so yeah, here we go. Let's do this. Gosh. Okay, I'm going to paste this and we're going to do it this way and hopefully it's going to work. Okay, so Dr. Jacqueline Rosenthal, who is very patient, is a neurologist at Andrew C. Carlos MS Institute at Shepherd Center in Atlanta. She is a graduate of Morehouse School of Medicine and completed her neurology residency at Madigan Army Medical Center. I hope I said that correctly.
Yes.
After completing residency, she practiced general neurology at Martin Army Community Hospital. And it was during this time that she developed a special interest in patients with multiple sclerosis and other neuroimmunologic conditions. After separating from the U.S. Army, she I already read that right. No, she completed her neuroimmunology fellowship at Atlanta VA Medical Center at Emory MS Clinic, during which time her primary research centered around the examination of neurodegenerative biomarkers of cognitive dysfunction in patients with multiple sclerosis. Dr. Rosenthal joined Shepherd Center's medical staff in July 2019. She participates actively in clinical research and has worked with various MS committees and work groups to further MS education and increase awareness. Outside of patient care and clinical research activities, she enjoys spending time with her husband, Kendrick, who is my brother, and her two sons, Andrew and Ethan, who I am proud to say are my nephews. And Jackie, I just thank you again for being here. I'm going to have to try to be what we call the producer and ask you questions at the same time. Okay. So please, as my phone is also dictating what I'm saying. So, so as we are having this conversation, I just want to thank you because I know I have seen an increase in MS diagnosis. I don't know if it's just because of the people that I'm around or if there is just an increase in the prevalence of it. So can you just first start by telling us what is multiple sclerosis?
For sure. So multiple sclerosis is more common than people would think. So we know there's about 1 million people in the United States living with MS, but it's an autoimmune condition. But what makes it unique from other autoimmune conditions is that it really is restricted only to the central nervous system. So impacting the brain, the spinal cord, and the optic nerves, which is what connects your eyes to your brain. And that's where the damage is done. That's where your immune system is incorrectly attacking the nerves, the myelin, which is the outer covering of the nerves, and that can cause various symptoms. One of the really important features about MS is that it's not just this one-time phenomenon. So there's attacks that can start and then stop, and then maybe something else happens. So that's that relapsing type of MS, which is the most common type of MS. And then sometimes it could just be progressive, where there's symptoms that are continually getting worse, but it's all due to these episodes of inflammation from where the immune system is incorrectly attacking parts of the optic nerve, brain, or spinal cord. And with that, it can lead to various symptoms. And so, again, it's an autoimmune condition. It causes inflammation in the brain, spinal cord, optic nerves, different places, different times, and it creates symptoms based on where those areas of inflammation are.
Okay. Now, typically, what type of symptoms do you see when your patients come in and they're diagnosed with multiple sclerosis?
So there's so many different symptoms that can present with MS. Some of the more common ones are going to be optic neuritis. So when that inflammation impacts the optic nerves, it can affect the vision. It's usually on one side, one eye at a time, rather than having both eyes affected at one time. But patients will come in and they'll say, you know, there's some pain with eye movement, or they start to have some blurriness in the center of the vision, and that can evolve over hours to days. And it's a really common first symptom. So that's optic neuritis. Another one is if the spinal cord is involved, it can cause various symptoms in the extremities. So it could be weakness on one side of the body, numbness, tingling. Sometimes it can affect the bladder, where it's difficulty kind of holding the bladder, or keeping things, or holding it, or letting it out. Either of those can happen. We can see sexual dysfunction. When the brain is affected as well, that can cause symptoms like impaired cognition, other sorts of cranial nerve symptoms, problems with swallowing, problems with speech, double vision. So there's so many different symptoms, problems with coordinating the arms or legs, a lot of different things that can come about. And the one tricky thing is, especially early on, sometimes those symptoms can be relatively short-lived. They may be there for a few days or a couple weeks and then get completely better. The longer someone has MS, the less likely they are to fully recover from those episodes. And then the other thing we know is that even if someone gets better, those symptoms get better, the damage to the brain or the spinal cord, it's still there, and that can cause problems down the road.
Okay. So how is MS diagnosed? Did you answer that already?
No, not yet.
Okay. Just make sure.
So there's not one test. It would be much easier if we just had one test that can rule it in or rule it out. So it can be difficult. And so for that reason, it's commonly overdiagnosed and underdiagnosed, unfortunately. But it's a combination of the history of symptoms someone's experiencing, what we see on the MRI. That's probably one of the most important tests that we do. Sometimes we'll do a lumbar puncture to look at the fluid that surrounds the brain and spinal cord, to look at that. There could sometimes be some supportive evidence of multiple sclerosis, but we have to take all of that and put it together and make a determination of whether or not someone has multiple sclerosis.
Okay. Now, let's see. So treatment. What was a typical treatment for multiple sclerosis?
We're fortunate now to have over 20 different immune therapies to treat MS. The first treatments weren't until like the mid 90s. So before that, we didn't have any FDA approved treatments for multiple sclerosis. So it's changed the landscape and the natural history of the disease over time. But the biggest category of treatment is going to be the immune therapies that we use to get the immune system to stop inadvertently attacking the brain, spinal cord, the optic nerve. Unfortunately, it doesn't do much to help recover function. That's a big area that we're still missing treatment for. So any recovery someone gets after these symptoms happen, or these attacks, it's from their own body trying to heal itself. It's not necessarily because the medications are making that better or fixing those previous areas of inflammation that caused that damage, but the medicines do stop there from being further attacks and new areas of inflammation and new lesions within the brain or spinal cord. So it's really important in preventing disability in the long term. And that's like the immune therapy. But then there's this whole other category of treatments that we use that we call symptom management. And I kind of think of that as like the quality of life stuff, right? So those are the things that we try to make better. And it's not necessarily fixing the underlying problem a lot of the time, but it does make it easier to get through the day. because ultimately the goal we have for a lot of our patients living with MS is to get back to living the life that they want to. So for example, we talked about it sometimes causing bladder symptoms. So if somebody is not necessarily, maybe not wanting to leave the house, they're scared they're going to have a bladder accident, or they keep waking up 5 times during the night to empty their bladder, then we give treatment to address that. How can we help you to control that? If somebody has problems with muscle spasms or nerve pain, or difficulty with balance, that sort of thing, what are some therapies or some things that we can do to try to improve those symptoms? So that's the symptom management side of the treatments that we have.
Okay. Now, from disability, what type disabilities typically does multiple sclerosis cause?
So that varies as well. And I tell a lot of people, especially some of my younger patients that are early, just diagnosed and are really scared that a lot of people do not have disability with MS. So just because you have the diagnosis doesn't mean that you're disabled or that you're going to be disabled. But we do see a lot of disability with the diagnosis because of the symptoms it causes. So, it can cause things that are kind of easy to see. If someone's using a walker or a cane or a wheelchair, they can't walk. But it can also cause symptoms that we don't necessarily see. So that's where like the cognitive symptoms come in, the pain that someone may be dealing with. And I will say in the two biggest categories in terms of symptoms that are really impacting people's day-to-day functioning are going to be symptoms that affect how you're able to use your arms and legs. And then symptoms that affect how you're able to think. Fatigue's another big symptom that we see that, isn't something that you can necessarily appreciate from the outside, but it's a huge symptom for patients living with MS.
Yes, and a lot of times I'm always talking about those invisible issues. Because the statement that I always am disappointed to hear is, "But you look good." But I can empathize with others who are having that fatigue. And in those fatigue moments, what would you best tell one of your patients? Should they be vocal about it and say, "I need to shut it down"? What would you recommend as a doctor to them when they're having that? What would you tell them to do?
So there's so many different ways to address it. So, it's kind of a last resort is to not be able to do the things that you want to do. So we try our best to try to combat that fatigue. And fatigue is such a prevalent symptom. It's not unique to MS. So lots of people experience fatigue for lots of other reasons. So I think when you're dealing with something like MS, where fatigue is a large part of the symptoms for a lot of people, it's easier to exacerbate in the setting of other things. So I always try to make sure that things that could contribute to fatigue are being addressed. So looking at sleep, looking at pain, things like that. We see a lot more sleep disorders in MS too. Things like, restless leg syndrome, sleep apnea. So again, those are kind of things that we want to address. Sometimes we do use medications to try to promote wakefulness. We try not to do that if we don't have to, because then you can sometimes cause some other symptoms later on in the day as the day goes on with having trouble going to sleep. We try to talk about exercise. Exercise can help with fatigue, making sure you're eating a healthy diet. But in terms of that being difficult for other people to understand, I also try to encourage patients sometimes to bring their family members in as well, so they can kind of hear it from me and how we're describing it, because it is difficult. And I do hear a lot of patients who struggle with there being that gap between what they're feeling and what their friends and family, the expectations they have, if you will, in terms of, kind of hard to meet those sometimes when you're just, you hit a wall at 3 p.m. every day.
And, and that is one of the reasons why Dear Encourager was created. We wanted to be able to have opportunities for our health warriors and their caregivers to be able to get the education and be able to have that support on both sides that they need. So I'm really glad to have you here as a physician to support that. Because, it's one thing for Keisha, the nurse / health warrior.
Mhm.
Vanessa, she's the oh, come on. She's the person who deals with people from a therapist. There we go. That's that word I was looking for. With Vanessa, therapist, and also being a former caregiver, it's real easy for people to say, "Oh, well, you can be biased because you went through it," but to have you here and you showing that importance is great, because I also see in this new profession that I'm in that a lot of these health warriors are going to these appointments alone.
Yeah.
And so if they're going alone, they are going scared. So you're already going to not think about certain questions because you're so fearful of dealing with the diagnosis, the fact that you're there, the fact that you're by yourself. And also, what we're going to talk about, which is going to be the next question, is maybe the myths and the stereotypes or whatever that they may have in their mind. But just to have you here saying that there's an importance, I'm really thankful. And I hope everyone who is watching really understands the importance of trying to go with a family member. And if you can't go with a family member, at least trying to be on the phone or FaceTime or Google Meet, whatever the web choice that you use, to make sure that you can get that information. So as a segue, let's talk about the myths. What are the myths of MS?
Well, I think one myth is that if you have MS, you're going to end up in a wheelchair. The majority of people with MS do not end up in wheelchairs. The majority of people with MS, you wouldn't be able to tell from looking at them that they have MS. And again, that's really a testament to the medications that we have. Now it has changed just the entire course. And it's also kind of, you could even tell from like a generational standpoint that, younger people that are diagnosed are doing better than older people who, when they were first diagnosed, didn't have those medications available to them. And so I always tell people as well, like, your MS is your MS. And it's like, I always use this example of like when you buy a car, you buy a new car, and then you, as soon as you buy the new car, you notice everybody else with that same car coming, right? It's like that with MS. You get this diagnosis and all of a sudden they're hearing all these stories about MS. And for some reason, for my patients, people like to tell them like horror stories. It's like, hey, I just got this new diagnosis. And then someone tells them the horror story, and it's just not nice. But I have to remind them that that isn't your story. And you can't take that in. So again, it's a very unique diagnosis. It's just so much variability from person to person to person. So that's one thing I would say about it. Another myth is that MS will affect like the length of life or increase mortality. That's another huge myth. We say that it can affect the quality of your life, not necessarily the quantity of your life. And so that's another area of importance for those, again, living with MS. We don't expect our MS patients to live a shorter life just because of that diagnosis. Another myth would be probably childbirth, having kids. You can definitely have children with multiple sclerosis. It's something that we definitely want to plan for. We would like for the disease to be under control before we go down that road, but lots of women with MS have families successfully where we're usually able to keep the disease under control with that. We just have to work together, definitely a partnership. Other myths would be exercise. I think this one we're kind of getting away from, but I know years ago, they used to tell MS patients to not exercise. There was this fear too of becoming overheated, which we do see. A lot of our MS patients had heat sensitivity. And not like a hot flash kind of heat sensitivity. It's more like they get hot and then symptoms, old MS symptoms or current MS symptoms can kind of flare up or feel worse. But what we know is that that's not necessarily hurting anything. It's temporary. And so we always encourage our patients to exercise. That is probably one of the most important things that someone living with MS can do. And that looks different from everybody based on disabilities and that sort of thing. So I have patients that run marathons and I have patients that do chair yoga and anything in between. And so movement is important. And there was one more I wanted to say. what was it? It was, just the demographic of individuals diagnosed with MS. It's definitely kind of an outdated idea that MS is a disease of young white women. That is certainly not what we're seeing. We're seeing it affecting a lot of different demographics, a lot of variance in ages, and Black women in particular are actually the fastest growing group of individuals that are being diagnosed with multiple sclerosis. And so that has played a little bit of a part in some people's stories of why they may have had a delay in diagnosis. So that's definitely a myth we're trying to work to, change that narrative on.
Well, that is something, although, of course, being that I am of African-American descent, Black, however you want to quote, state it, I am starting to see a lot more people who are minorities that are being diagnosed in my professional realm, of talking with people. And that was, I'm going to be honest, I was like, wait, all of these people, never heard that before. And now as I'm starting to see people share their stories and watch them, and I'm like, wow, this is something that we need to watch for. And with, let's say, how we're hearing about the changes in care for people of color, as far as from an obstetrics and gynecology standpoint, do you think that maybe some of the same type issues that we're having with the diagnosis of MS, the stereotypes that people are trying to overcome, that I'm not going to try to name all of them, but, do you think that could be a possibility of some of the actual misdiagnosis?
I do. I mean, there's health bias in the healthcare system it's prevalent. And I mean, everyone's biased to an extent. It's part of being a human being. But absolutely. I think that's part of why we tend to see, if you look at Black individuals with MS, they are on average, I think the last demographic on that or stat on that was 7 years later diagnosed. And so there is a delay in diagnosis. There's also a lot of different social and economic factors that are going to contribute to that as well. But I think there is a bias. I think that some healthcare practitioners maybe aren't aware that people of color are still at risk for MS, if just as much, if not higher than those of white or Caucasian descent. So that certainly plays a factor into it, but it's also part of why, even when you look at obstetrics and MS, and really in the context of the historical discrimination in the healthcare system, it's important for patients, regardless of what you look like, to always advocate for yourself and educate yourself about these symptoms. And when you, like you alluded to this earlier, when you go to that visit, if you don't have someone with you, you should still have a plan of things that you want to address. If that means you wrote it down, if that means someone's on the phone with you or a video call to advocate to you. Sometimes I have patients that maybe a friend or family member will send me a list of things they want me to discuss before the patient themselves get there, just to make sure that we're kind of checking all the boxes. But those things are important to try to address some of those things.
Now, I know you go to a lot of conferences and such, and you speak a lot, and you've been named who's who among Atlanta doctors and all. So yes, I did have to say it. Sorry, because I'm so proud of you. I've been dying to say that forever. So I'm not saying it behind your back. I'm saying it with you in my presence. I just want to let you know, we thank you. When you go to these conferences, do you see that there is an increase in neurologists who are going into the study of multiple sclerosis? Because, I noticed that our neurologists and all of our specialists, there's a decline. But do you see an increase in those going into the field?
That's kind of hard to answer. I think there is an increase just based off of there's a lot of new things coming out within MS and different treatments and a lot of research. So I do think that's attractive. But at the end of the day, we still don't have enough MS specialists. We still don't have enough neurologists. And so we need more. But maybe a relative increase, but still we need to do better.
Okay. Because I'm asking because, like in my area, my neurologist, he just retired and I almost had a nervous breakdown because I'm like, what am I supposed to do without you? But I know also in areas, like in Alexandria, where I'm from, there are not a lot of specialists, and people have to go to certain areas, different areas to be seen. And I know, being that you have some ties to New Orleans and doctors there, and from a Dear Encourager standpoint, just because I have to say things when I remember, if you could possibly share any neurologists that who specialize in multiple sclerosis, for that matter, anywhere, that would be great, because the wonderful thing is that Dear Encourager, we can reach a lot of people virtually. So if we can help bridge that gap by offering the names of neurologists in different areas, I would really love to be able to serve the people that way. So, just my little thing I just thought of right now. And my last question, how do you think people can increase their quality of life living with multiple sclerosis?
So, I think initially a lot of patients, when you're first diagnosed with any chronic disease, there's like a mandatory grieving period, right? Which is completely normal. But once there's, kind of get to that acceptance phase, I think it's about looking at the things that kind of bring you as an individual happiness. What are the things you look forward to? And then working together with your healthcare team to try to accomplish those things. So that looks a lot of different ways. We definitely recommend exercise. I'll say that again. Movement is key. We recommend community and social engagement. We want people to interact with other individuals. The pandemic, for example, really hurt a lot of patients, not just MS, people everywhere, because they lost that community, that engagement with other people. So that's important. We focus a lot too on just mental health. We do see higher rates of mood disorder, anxiety and depression in our MS patients, and it's more than what you would just expect for someone having to deal with a chronic disease. Or so there's something going on that's contributing to that. So we try to make sure we address that as well. Those are all going to be just important things to set yourself up to do the things you want to do, and then, like we talked about, advocating for yourself. If you used to travel, but now you don't want to because you're scared to navigate the airport. Well, we have a plan for that. So just talking to us about it and us finding new ways to accomplish the things that you used to do. So not giving up on things that used to make you happy. Again, I have a lot of patients that, they got the diagnosis and maybe it was a little bit of a mental setback. And then they say, hey, I'm still going to go to medical school. I'm still going to practice law. I'm still going to do these things that were important to me. It may look a little different how I accomplish it, but I'm still able to do it.
I love that you were talking about, not giving up on their lives. And again, that's another reason we feel that support groups are important, because sometimes you got to have somebody to kick you in the butt when you don't want to get up and do what you need to do. And I feel if we have more people who are encouraging each other through this journey, that we will be better people and we will have better outcomes. So I am just over the moon that we actually had this conversation, because I've been excited for it to happen. And I thank you so much for your patience.
Thank you for having me.
And I'm trying to see if anyone has any questions, but so far I don't see any. I'm going on over here. I just see some love, some hearts, and those wonderful things, and some checks. But I would hope that if you all have any questions, and we say this all the time, let us know. Put it in the comments. And what I will do is I will make sure if you have those questions, if you don't mind, Jackie, if I could send those questions to you.
Sure. Yeah.
I know nothing. I just know how to get the questions over to Jackie.
There we go.
To make sure that your questions are answered. But everyone, just stay encouraged if you're going through this diagnosis, and you should have hope, in my opinion, because she just told you if you were diagnosed, there are medications out there now that's going to help you live your life longer, and you're going to have better quality of life. So Daryl says hi to Jackie and Keisha. Hi, Daryl. How you doing? We love you. But please stay encouraged. Even if you don't have MS, if you have anything, stay encouraged. Because I know there are going to be some bad days, like there is with anything. Mm-hmm. But stay encouraged. Talk to your medical providers. Advocate for yourselves. Make sure that you have someone, like Dr. Rosenthal just said, have someone to help write out your questions before you go to the doctor, before you go, or call in and come up with a plan. You want to live your life, come up with a plan of what you want to do. Because I know some people probably thought when I came up with my plan in the midst of what I'm going through, I had lost my mind, because I literally jumped in the fire real quickly and didn't let the skillet heat up a little bit. So make sure you talk to the people about your plan to make sure you're not trying to do too much. But know that you can still live a great life. Mm-hmm. You can. Okay. So Dr. Rosenthal, my sister-in-law, do you have any final words you want to say before we get off?
No, I think you wrapped it up beautifully. Like you said, stay encouraged and advocate for yourself. Try to live your best life.
All right. Well, everybody, I'm sorry I ran you late today, but thank you so much for paying attention and logging in. Please still share this, and remember, you can ask your questions, and we'll make sure we get your questions over to Dr. Rosenthal and get you some answers. Well, everyone, have a great night. Take care. Bye. Mm-hmm. Mm-hmm. Making sure I'm logging out of everything. Uh-huh. Uh-huh. Yeah. Okay. Yeah.
I think this one's still live too. Yeah.
Got it? Yes. We are all gone.
I think this platform here is still ticking on.
Yes, it sure is. All right, y'all. Bye.